Once again, you're especially welcome to this program. So now, on behalf of the Ministry of Health, the National Health Insurance Authority of Ghana, and in collaboration with the sponsoring partners, USAID, HFG, and the World Health Organization, I especially welcome you to this international conference themed Financial Protection and Improved Access to Healthcare, Peer-to-Peer Learning Workshop, Finding Solutions to Common Challenges. May I also state that we have delegations from about 9 countries and other international organizations here in Ghana for this program. As and when it becomes necessary, there are headsets on your table, so there'll be translation ongoing. You can use that to catch up with discussions. So you're welcome to Ghana. Those of you listening the first time, in Ghana we say Akwaba, or we say Wezo, and you're welcome to the land of peace, the land of tolerance, and the land of nice people. So I want to begin the opening session, and to chair the opening session is Akua Kwatin Ado of the USAID Ghana Mission. Round of applause for her, please.
Good morning and welcome to everyone here. May I ask the speakers to join me on the high table? Ms. Megan Rhodes, the Honorable Minister of Health, and the U.S. Ambassador Robert Jackson. His Excellency, the U.S. Ambassador to Ghana, Robert Jackson, the Honorable Minister of Health, Mr. Alex Sigbefia, the Assistant Administrator for Global Health at USAID, Dr. Ariel Pablos Mendez, the Deputy Chief for Health in USAID's Africa Bureau, Ms. Megan Rhodes, distinguished participants, country delegations, good morning. It is my distinct honor to welcome you all to Accra and to the Financial Protection and Improved Access to Healthcare Peer-to-Peer Learning Workshop. I am very honored to welcome representatives from near and far, presenters and health financing experts from across the globe, from Washington, Seattle, Switzerland, Mexico, health financing country teams from Ghana, of course, our kind hosts, Rwanda, Ethiopia, Nigeria, Uganda, and from La Francophonie, Togo, Côte d'Ivoire, Benin, and of course, le pays que j'adore, le Senegal. This indeed promises to be a special week for health financing on the continent, and we have a very packed agenda. So without further ado, it gives me great pleasure to call Ms. Megan Rhodes, the Deputy Chief for Health in USAID's Africa Bureau, to address us first.
Madam Chair, His Excellency Ambassador Jackson of the United States, Honorable Minister of Health of Ghana, Alex Sigbefia, Chief Executive of the National Health Insurance Agency, Nathaniel Otu, Honorable Ministers and representatives from Ministries of Health and Finance from Benin, Côte d'Ivoire, Ethiopia, Ghana, Nigeria, Rwanda, Senegal, Togo, and Uganda, Members of Parliament, representatives from national and state health insurance agencies, all delegates representing 9 countries, representatives from partners, colleagues, members of the press, distinguished guests, all protocol observed. On behalf of USAID and co-sponsors WHO Afro, WHO Geneva, and the Gates Foundation, it is my sincere honor to welcome all of you to this workshop on financial protection and access to healthcare. USAID, WHO Afro, WHO Geneva, the Gates Foundation would like to extend their profound gratitude to the Government of Ghana, the Ministry of Health, and the National Health Insurance Agency for hosting us, all of us here this week. Given Ghana's leadership on this issue, it is only fitting that we convene here in Accra. The momentum for recognizing health financing as essential to strong health systems is evidenced by the groundswell of interest in this week's workshop. What started out as a meeting envisioned for about 30 to 40 people from across the continent has grown into the reality of this large gathering today. because of the interest and commitment on the part of all of the countries represented here. This momentum builds on the joint commitment made by Ministers of Finance and Health, reflected in the 2012 Tunis Declaration on Value for Money, Sustainability, and Accountability in the Health Sector. This week, we aim to further the commitment made in that declaration by focusing on financial protection as an important means of attaining universal health coverage. As development partners, it is a privilege to be a part of this dialogue and momentum towards achieving universal health care. For USAID's own part, our own Assistant Administrator, Dr. Ariel Pablos Mendez, has provided excellent leadership in advancing health financing, both at the global and country level, and fortunately for us, he's here with us today, and you will hear more from him this morning about his efforts and his vision. We hope today that the world-class body of experts and leaders gathered here will be able to take the health financing agenda to the next level and work in partnership with all of you to attain universal health coverage with equity and sustainability. Thank you again. Welcome, bienvenue, and Akwaba.
Good morning, bonjour. Honorable Minister, Mr. Utu, the CEO of the National Health Insurance Agency, Dr. Pablos Mendez, Mr. Karras, distinguished guests, ladies and gentlemen, this is my first public appearance as the U.S. Ambassador to Ghana, and I'm very happy that it's on such an important subject. It's an honor to be here today for the opening of this important workshop. I arrived in Ghana exactly 1 month ago today, and I'm heartened to see so many key players from around the region gathered here together to work on this important goal, bringing health care to every woman, man, and child. I thank USAID and the government of Ghana for making this week happen. And heartfelt thanks go to our participants from Benin, Cote d'Ivoire, Ghana, Ethiopia, Nigeria, Rwanda, Senegal, Togo, and Uganda. We've got great representation here, a lot of different systems, a lot of different approaches, and I hope that this will be a rich week for sharing experiences. More important than the sharing, though, your very presence demonstrates the willingness of your governments and organizations to put in the hard work necessary to achieving universal health care. Making universal health care a reality could not be more important. 400 million people globally lack access to one or more essential health services. Every year, 100 million are pushed into poverty, and 150 million suffer financial catastrophe because of out-of-pocket expenditure on health services. Universal health care is a key step in eradicating poverty, improving health, spurring economic growth, and fostering development. A society where everyone has access to health services is a more stable, united, and prosperous society. Last September, the UN Sustainable Development Summit brought together 193 countries to formally endorse a new blueprint to transform our world. President Mahama formally launched the Sustainable Development Goals in Ghana just last Friday. And critical to this vision is the goal of achieving worldwide universal health care. I'm proud that the United States government is partnering closely with country governments and the World Health Organization in the pursuit of this achievable milestone. But achieving it will not be easy anywhere, including in high-income countries like the United States. Governments will need to devote more resources to health. This is challenging, but very doable. If the African Union countries increase government expenditures in health to 15% of their budgets, as pledged in the Abuja Declaration of 2001, together they could raise an extra $29 billion per year to pay for health care for all. Private providers, insurance, and other companies in the health sector also have pivotal roles to play. In many countries, the private sector provides the majority of health care. I've observed this throughout West and Central Africa. In Cameroon, where I served as ambassador for 3 years, private facilities provide nearly half of all health services. The private sector also dominates the provision of family planning and reproductive health services there. 80% of all modern methods are obtained from this sector. This week, we will have the opportunity to learn from each other and identify best practices to achieving universal health care. Here in Ghana, there are a number of lessons to share. Ghana's national health insurance scheme is one ambitious example. Established in 2003, the National Health Insurance Scheme currently covers 40% of the population. It has received wide recognition as a successful model for social protection and has significantly increased utilization of health services towards universal care. The U.S. government, through the U.S. Agency for International Development, collaborates closely with the National Health Insurance Agency to support its financial sustainability, increase enrollment, and improve effective coverage of quality health services. We work together to cut costs, fight fraud, and to give Ghanaians access to the best, most comprehensive healthcare services. Change is possible when we partner together and learn from one another. Between 1990 and 2015, the global rate of children dying before they reach their 5th birthday was slashed in half. If we all continue to collaborate as we are doing this week, I'm confident that we can build on that success and usher in a world with health care for all. I would like to express my sincere thanks and gratitude to Ghana's Ministry of Health, to the National Health Insurance Authority, the World Health Organization, colleagues at the U.S. Agency for International Development, and of course, all the participating countries present here today. Your dedication has made this workshop possible. I wish you a productive week, one that will pave the way for a future where all people can access the health services they need to grow, thrive, and contribute to society. I thank you very much.
Your Excellency, the Ambassador to the United States of America, Mr. Robert Jackson, the representatives from USAID and all our development partners, all the delegates and representatives from different parts of the world, and Africa especially, distinguished ladies and gentlemen, and I stand on all other protocols that have already been observed. Good morning. I am delighted to join you here today at the opening of this workshop on financial protection and improving access to health care. Let me take this opportunity to welcome our friends from sister African countries of Benin, Côte d'Ivoire, Ethiopia, Nigeria, Rwanda, Senegal, Togo, and Uganda, as well as those who have journeyed here from Mexico, Switzerland, and the United States. I'm told that this is the second of such workshops we have had the honor of hosting in Ghana. Our objectives: to raise awareness on the linkage between health insurance schemes and the need to eliminate catastrophic health insurance costs. We therefore feel very privileged to share lessons from Ghana's National Health Insurance Scheme, which is our primary vehicle for ensuring quality health care for for every individual, especially the poor and the less privileged in society. This is a very unique year in our history. This is the year that we are starting with the implementation of the Sustainable Development Goals, which officially came into effect on the 1st of January 2016, and are expected to guide the decisions of member states over the next 15 years across all sectors. Target 3.8 is to achieve universal health coverage, including financial risk protection, access to quality, essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines. I believe that the theme for this workshop is derived from the need to ensure that we start building the necessary structures and systems to meet this target. In Ghana, we strongly believe that everyone should have access to affordable, quality health services. And while our commitment is universal, we are putting a special focus on expanding access to vital services for women and children. Our National Health Insurance Scheme has made a concerted effort to support those vulnerable groups. Maternal health care services under the scheme are free. We have established an extensive basic benefits package, which covers 95% of all health problems reported in Ghanaian health care facilities. The scheme has accredited over 4,000 public and private healthcare providers at all levels of the health system to ensure that the promised services are made available. The impact of the scheme on health-seeking behavior is also clear. 3 in 4 births in Ghana today are assisted by a skilled provider compared to less than 1/3 of all births in 2003, when the scheme was first established. And when a fever or cough, which are common symptoms of malaria in Ghana, is reported for a child, the likelihood of seeking formal medical treatment is 66% as a result of the scheme. Our dedication to quality of care should not go unnoticed. We have been undertaking regular clinical audits and taking steps to improve rational drug prescriptions. Ladies and gentlemen, these gains are a testament to the ongoing efforts of our health workforce, collaborators, and development partners, for which we are deeply appreciative. Nevertheless, like many of our peers, Ghana is facing an epidemiological transition that is accompanied with a higher burden of non-communicable diseases. Health costs are escalating, and this is beginning to pose a threat to the long-term financial sustainability of the National Health Insurance Scheme. Last year, the Ministry of Health inaugurated a National Health Insurance Technical Committee to holistically review the scheme and provide inputs for its reforms. The committee is still working. We hope and anticipate that this review will help us to address matters related to reimbursements and leakages that have emerged and ultimately lead Ghana on its path to achieving universal health coverage. Advancing financial protection and universal health coverage remains a priority that is outlined in Ghana's health sector medium-term development plan. Our goal is to implement evidence-based health sector reforms and contain costs, while at the same time expanding and sustaining coverage. We recognize that there is no single pathway to achieving universal health coverage, and we know that despite our best efforts, every year an estimated 350,000 people in Ghana still face poverty as a result of out-of-pocket health costs. So we must pay special attention to affordability for the poorest of the population. As a government, we take the challenge very seriously. Ladies and gentlemen, this workshop would allow us all to learn from one another's experiences as we chart on our paths. Some of the questions we must ask and be bold about are: what are the best ways for governments to engage private sector partners while ensuring equity and quality? Why are some countries able to achieve better maternal and child health outcomes than others with the same level of resources? The countries that will be most successful in expanding coverage will be those in a mode of continuous learning of their experiences and are able to adapt their approaches based on the best available knowledge and evidence. And so, as to the outcome of this workshop, I encourage us to launch a community of practice on health insurance and health financing. On this note, I wish to thank the National Health Insurance Authority, USAID, and the World Health Organization for their excellent work and partnership in making this event possible. I wish you all a very successful and productive 5 days. Thank you, and God bless us all.
Thank you very much, Honorable Minister of Health. And now I think we are going to ask Ms. Ishrat Hussain to give us a few comments and logistics.
Madam Chair, Your Excellency, Ambassador of the United States to Ghana, Honorable Minister of Health, Acting Chief Executive of the National Health Insurance Agency, Assistant Administrator of USAID, Global Bureau of Health, and distinguished participants, all protocol observed. I really like that phrase. I'm actually thrilled at the response by the countries as well as by the partners to the invitation to this meeting. As Megan earlier pointed out, it started as a very small event and has grown 4 times. We are particularly impressed by the response from Nigeria, Senegal, and of course our host country Ghana. We are really thankful not only for hosting but actively participating in this meeting, Honorable Minister. It is doubly gratifying to see the eagerness of the countries to address urgent and difficult challenges of our time, and that is equity and financial protection. As we all know, and we will discuss during the course of the workshop, equity is not only essential for economic growth and poverty reduction, but I would sum it is our moral imperative. We worked hard in designing the agenda. We wanted to customize it to the needs of the countries, so we extensively consulted our colleagues in the field. And I would like to share the 2 messages that we got from the field in the course of this discussion. First, the need to focus on implementation and governance issues. And they really did not want to focus just on technical aspect, but on very practical aspect, how to improve implementation and governance. And I'm delighted at the composition of the participants here, because they are all those who have been working day in and day out on solving various problems. So the second point that our colleagues from the field made was that we should emphasize finding solutions to common problems and not just discussing the problems alone. So what are the expected outcome of the meeting? Honorable Minister already pointed out that we should have some community of practice out of this meeting. But the most important point I would like to make is the middle one. That is the outcome of the meeting. We should identify concrete actions to take the health financing and health insurance program to the next level, wherever it is at the moment. And how we would like to do that, this is the first and the third point, that is deeper understanding of how to grow financial resources and utilize them better. And the second is that how do we strengthen partnership within the country, with the partners, and among the countries. So how we want to do it, so we try to move away from the traditional learning approaches and try to adopt newer and more innovative approaches which are based on peer-to-peer learning, participatory design, as I pointed out, that we extensively consulted the field, and then the mix of interactive methods like roundtable talk shows to make it more interesting and more engaging. Then we also included several themes in a session. So each session is divided into 3. First is the state of the art to get the latest update on the science. And the second is that we wanted to deep dive into the experiences of one particular country. So that's the spotlight country. And the third is the general sharing of experiences of the countries that are present there. And then, of course, I think most important is that we feel that if the learning takes place in a team, it is much more effective. So there are country teams from the 9 countries, and these teams comprise various stakeholders so that when they go back, the implementation would be much easier. And of course, we expect that they would be working on their plan and getting the ideas during the course of the week. So now the next point I would like to show is what is the thinking behind the agenda. So the thinking behind the agenda is that on the first day, we will be talking mostly about the basics or the concepts so that we are on the same page. And the concepts really relate to equity, financial protection, and then there is this newer area, behavioral economics, which is emerging, which has quite a significance for the topic that we are talking about. Then the next day, we will be talking about health financing, and the health financing from 2 sides, that is domestic resource mobilization as well as expenditure and management. Then on the 3rd day, we will have the unique privilege of visiting and looking at the National Health Insurance Program and the health systems, and we are really looking forward to it and discussing on the ground the health financing reforms in Ghana and learn from our colleagues in the field. And then on the 4th day, we will be talking about how to expand the coverage, how to improve the health insurance program. So the topics are community-based health insurance program, the private sector, and of course emerging mobile technology, which I think holds great promise for the National Health Insurance Program. And finally, on the last day would be developing the action plan, but most importantly, developing the measurement tools. And now we are living in an era where we can monitor and measure more effectively because there are tools that are being developed, then there is mobile technology which is available, then of course there is emphasis on the big data. So I think that should be the emphasis at the last, that we should be able to measure the impact. So going forward, what success would look like after we all go back home. And I hope that the success would be to improve the implementation of the actions that you decide on here, and also I think the focus in the country, how to improve the implementation of the existing program. Then secondly, of course, monitor progress and measure impact. And we hope that you will be able to emphasize the second part so that we learn from what we are doing. So here in conclusion, I would say that we are really excited about the week ahead, and I want to thank you all from the bottom of my heart for responding so well, and we would provide whatever opportunities we can for you to to use the resources in this room effectively. We will be distributing the bios of the resources that are available, the participants and their specialization, because you will be amazed what kind of skills are represented here. And Senegal is providing the best practical examples. They want to use these resources to develop their health financing strategy, and we hope others will do that, and we are at your service, and thank you very much.
We will soon take a break. We call it the icebreaker. And we will want to introduce the various delegations here. We have about 9 countries represented here, together with international organizations. We want to hear from each of them. We'll give 1 minute each to the lead for each of the delegations. So we hear what the expectations are, and we hear why really they are here. So we want to start from our brothers from Nigeria. Shall we have a word from the leader of the delegation?
Okay. Your Excellency, the Honorable Minister of Health in Ghana, Your Excellency, the American Ambassador to Ghana, my colleagues that are here, all protocols duly observed, I want to bring you greetings from the Nigerian government. My name is Francis Ukwije. I lead the healthcare financing team in the Federal Ministry of Health in Nigeria. So as you can see, Nigeria probably has the largest delegation to this workshop. It is not just because we are a very large country, but again, it is also shows how important we ascribe to this workshop and what we're going to take away from it. So Nigeria is coming from a background of a very critical period where not only that we have changed politically, but again, we are embracing very great reforms in health generally and healthcare financing. So how do we ensure that most of our population, especially those who are most in need, are covered on financial protection mechanisms? And since we have iterated a lot of mechanisms and methods over some years, it is time for us to begin to look for a way of moving very quickly towards universal health coverage. And that led to the presidential declaration a few years back. And then the new law, the National Health Act, is also giving us an opportunity to also look at some other reforms. So we believe that this workshop will give us an opportunity to look more in depth into what has happened so far, and then the critical steps to take to get towards universal health coverage as quickly as possible. Right. So we'll be learning from the other countries that are here and also sharing our experiences. Thank you very much.
Le ministère de l'économie et des finances, le ministère de la santé et l'agence de gestion de l'assurance maladie obligatoire, donc, et l'OMS. Voilà. Ce que nous attendons de cet atelier, c'est également de pouvoir capter des autres pays qui sont un peu plus avancés, certaines expériences qui pourraient aider la Côte d'Ivoire à avancer davantage dans son processus de mise en place de son assurance maladie obligatoire. La loi est déjà disponible, l'agence de gestion de l'assurance maladie obligatoire est également fonctionnelle, mais on a besoin d'avoir également d'autres éléments pour peaufiner davantage l'offre de soins et tous les autres mécanismes qui peuvent accompagner le processus. Merci.
Thank you very much. Ethiopia.
This good opportunity. From Ethiopia, we are represented from the National Health Insurance Agency, from the APT Associate, HSCFR, HFG project, from WHO. Ethiopia just started the social health insurance scheme in the past, the health insurance scheme in the past 5 years, so that we are running the community-based health insurance. We have covered almost half of the districts found in Ethiopia, although it's a very big country. And we are starting the social health insurance, so we are going to we are planning to merge this health insurance together in the next 5 years. So our main purpose here is to get experience from other countries, especially from African countries. Thank you very much.
Thank you very much.
Representatives from public and international organizations. The three key main expectations from our meeting. One is to look into the best practices of NHIF for Ghana, where it has managed to have one scheme as opposed to some of the countries which have highly performing schemes but which are not integrated. So we want to look into what was the roadmap, what are the key challenges, and really what's the secret behind success. As you know, Rwanda has a very good coverage towards UHC. As you all know, UHC is just a direction, not a destination. But we also have social health insurance, we have community-based insurance, we have private insurers, we have community-based smaller schemes. So what does it take to have one integrated scheme? Two, you will find that the coverage in Rwanda is mainly from the community premiums. Ghana is from the taxpayers' money. So how has the stakeholders, including the Ministry of Health, made an investment case to convince the Ministry of Finance to really allow for such a system in place? This is because under the Economic Development Poverty Reduction Strategy 2, health is considered as to get flat funding, irrespective of the GDP growth. In the earlier iterations of our economic development strategies, portions, health was one of the pillars, but now it's a foundational pillar. So this means we simply don't have more money from taxpayers. So how can we creatively finance the sector?
Okay.
Thank you.
All right, thank you very much.
Du Premier ministre sur les questions de santé, les élus locaux, l'USAID, l'OMS. Donc c'est un ensemble partenaire, les mutualistes aussi, voilà, la société civile. Donc autant de partenaires qui viennent pour échanger, pour apprendre ce que font les autres. C'est dans cet esprit que nous avons préparé cette réunion et nous pensons que ça nous sera profitable. Ça fait 3 ans officiellement que ça a été lancé chez nous en 2013. Nous avons fait notre chemin. Il y a des choses que l'on peut partager. Nous avons aussi besoin de savoir ce qui se fait dans d'autres pays. Et nous sommes convaincus que rentrant d'ici, nous serons enrichis des expériences des autres. Merci.
Thank you. Togo.
Merci beaucoup. Nous sommes un petit pays, donc une délégation de seulement 4 personnes. Une personne du ministère de la Santé, une personne du ministère des Finances, une personne de l'OMS et un médecin conseil d'assurance privée. Alors le Togo a une assurance maladie publique, mais qui s'adresse uniquement aux fonctionnaires, pour l'instant. Donc nous sommes venus ici apprendre de l'expérience des autres pays africains qui sont déjà bien loin et voir comment nous pourrions étendre notre assurance maladie à toute la population. Merci beaucoup.
Uganda.
Has 6 members from different, representing different stakeholders. And from what I've heard, I think Uganda is still in the premature stages of establishing the National Health Insurance Scheme. We started some time back, but we've not really taken off. So our main aim of coming here is actually to learn and from those who have been implementing, and we hope that what we shall learn here will help us to expedite the process of starting or making our health insurance scheme take off. As I talk now, when you look at the Ugandan population, only about 1% has had any experience or benefited from either the private or community-based health insurance schemes. So we really hope we shall learn a lot and not have to reinvent the wheel, and probably we shall move faster than other countries when we have gathered all the experience and challenges from this workshop. Thank you.
Thank you very much. And last but not the least, the host country, Ghana.
I was going to delegate, but I've been forced to speak. There is one thing I know for sure. If Ghana does something and Nigeria does not do it better, it means it's very difficult. We had a coup d'etat in the 60s, they had one. We won the Football Cup of Nations, they did. We went to democracy, they did. We have good elections, they did one better last year. The path to universal health care, universal health coverage is not easy. And in Ghana, we've been experimenting so far. We also have a lot to learn. And we believe that this opportunity will afford us the ability to learn from the experiences from all in here. I believe there's a lot of brain power in here, but I'm surprised we don't solve our problems. It means that what we are at is really complex, and we need all the knowledge, the skills, and experiences we can get. And I hope this event affords us the opportunity to do so. Thank you very much.
Thank you very much, Nathan. Shall we invite Amanda Forson to take us through what exactly we're doing in this icebreaker session? Thank you.
So I'm pleased to have my voice partially back and want to introduce our icebreaker exercise for today. I've been part of the design of this workshop. It's been a pleasure. I work at Results for Development Institute and am a partner with the Health Financing and Governance Project of USAID. But I spend most of my time working on the Joint Learning Network for Universal Health Coverage, the JLN, which is a peer-to-peer learning network among 24 countries now. 4 of those countries are represented in this room. And we really try to use a lot of the interactive methods that are part of the agenda this week. So for the icebreaker, we have 3 simple goals. The first is to roam around the room and meet colleagues from other countries, meet somebody you don't already know. A second important goal is to share your priorities and implementation challenges. As Ishrat noted in her opening remarks, as we designed the agenda, we heard a lot from you about what you wanted to focus on, and I hope you'll find that the agenda reflects that. But we also want to really hear what are top of mind priority implementation challenges you're facing. We want to go beyond the theory to really dig into some of the implementation issues. So in just a moment, I'm going to introduce a voting exercise that's very simple, just to hear from you about your top of mind priorities. And the third goal for the next half of an hour is for you to grab a cup of coffee. We have coffee outside the room, but it's an opportunity to mix and mingle with your colleagues and meet one another. So that's what we have planned. So to introduce the voting exercise, I just ask that we have identified 10 questions. And these are framed as how-to questions that come up a lot in countries. These are common challenges that I think many of you will recognize. And there are probably numerous other challenges that didn't make it on the list. But what we'd like to ask you to do is to think about and discuss with one another, what is your priority implementation challenge that's really top of mind for you at the moment? This will really help us think about how we can both target our discussions this week, but also help with following up. So please think about what one is your top priority question and write it on a sticky note. And each table has a set of sticky notes, and you take one, just one, please, and write the number of the priority question on that sticky note. And please also indicate your country or where you're coming from, which will also help us to understand what the priorities are for different countries. So that's the exercise. It's a simple vote. We're going to collect those after the coffee break and then tally them up. And we'll share with you after lunch the results, so we know kind of what are the topics and themes that really are dominant in this group. So that's the plan for the voting exercise. So I encourage you to reflect, discuss with colleagues, get some coffee, and make sure you write your number, your priority number, on your sticky note. We should have the questions translated into French is on the screen over here for our Francophone colleagues. So you might have to step around to see the questions that are written in French. So I invite you to mix and mingle. We'll be meeting back in here for our Setting the Stage session at 10:30. Until then, please vote, meet each other, and enjoy some coffee. Thank you.